There are a few current practice issues that affect the physical therapy profession. American Physical Therapy Association national leadership consists of a board of directors, a house of delegates, and multiple committees and other board-appointed groups. The American Physical Therapy Association members are further represented by the association's state chapters and special interest sections, each with its own leadership, as well as a Physical Therapist Assistant Caucus, a Student Assembly, collectively called components, an American Physical Therapy Association House of Delegates, which meets each spring, is a representative body of members comprised of voting chapters, delegates, and non-voting section delegates, among others. If a physical therapist has an issue, they will bring it to the Board of Directors, and then the Board of Directors brings this idea to the House of Delegates, where it is further investigated. And if further investigation is needed, they create a task force which consists of people interested in the topic to further research the issue. Then they will report back to the House of Delegates, where there will be a vote to see if it passes. If a physical therapist assistant has an issue, they will bring their issue to their chapter, and it will be beneficial for an opinion to be heard by the chapter representative and the Physical Therapy Assistant Caucus in case there is a disagreement with one or the other. According to the APTA website, the American Physical Therapy Association recognizes physical therapists' abilities to utilize appropriate support personnel, including but not limited to the physical therapist assistant, when directing and supervising selected aspects of the physical therapy intervention. The writers of RC 3-11, which is comprised of RC 13, offer the following rationale in their support statement for the motion. Positions physical therapy so it can grow as a choice for the public under new healthcare systems, reinforces autonomous practice of the physical therapist, supports the physical therapist providing care under potential new payment systems, and is more consistent with the standards of practice of physical therapy, specifically noted in Section 3, Patient-Client Management. The physical therapist provides or directs and supervises the physical therapy intervention consistent with the results of the examination, evaluation, diagnosis, prognosis, and plan of care. The writers clarified that all the interventions would be provided under the direction and supervision of the physical therapist. Basically what this means is RC13 is a new proposition from private practice physical therapists that state that the physical therapist can select the care extender that is most appropriate for their patient's needs. Currently, physical therapists can only supervise a physical therapy assistant or aid in therapy. RC13 calls for the PT being able to supervise who they deem appropriate, such as an athletic trainer, a massage therapist, or an exercise physiologist, in addition to a physical therapy assistant. The quality of patient care is the most important part of this change, and the main reason for it. The physical therapist is the one who can supervise individuals and deem them appropriate, and their experience and education will ensure that unqualified individuals will not be delivering therapy. This affects other health professionals in a good way because physical therapists can call them into their private practices to work with them, which would make their practice more diverse in treatment and care. This can be beneficial to a physical therapist that needs a massage therapist to work in their facility to treat patients with injuries. Also, massage therapists may be needed to properly remove toxins from the muscle during repair and regrowth exercises with the physical therapist assistant. Instead of the patient seeing the physical therapist and then leaving their facility to make an appointment with a massage therapist, they can just see the massage therapist there. This cuts down the costs for the patient and insurance company. This can also benefit the practice as a whole by gearing specific people to specific therapy needs, such as an athletic trainer for the athlete who needs to rebuild athletic functioning along with a physical therapy assistant. The delivery of this method may help based on the needs of our patients with a broader scope of the individuals at work. I believe these could work well together with the physical therapy assistants, but also could hinder the profession of the physical therapy assistant as a whole. On the opposite end of the spectrum, having someone specifically educated to assist the physical therapist in his or her therapy is important in itself. Having different professions from different areas come in may in fact hinder the entire profession of physical therapy, not just the physical therapy assistant, but the physical therapist as well. Physical therapy is a practice in itself, along with many others. Bring them together, they can take from one another. This affects the physical therapy assistants in a bad way because the physical therapist wouldn't need them. A physical therapy assistant is educated to assess and assist the physical therapist in a 2-year associate's program. Other health professionals may have more experience and knowledge on the injuries and techniques and treatments for the patient. This was not implemented to get rid of the physical therapist assisted profession, but rather to both further research our current methods and explore new ones. The physical therapy field and delivery needs to always be adapting, changing, and growing to keep them current and evolving for the best interest of the profession. The American Physical Therapy Association is an organization that brings together all involved in the physical therapy field. It is very useful in having your voice heard with the physical therapy community, which can greatly impact your role as a physical therapy assistant.